Sometimes it's just a matter of the right place at the right time.
Paying attention. Everybody opportunity to show themselves.
Probably 6 a.m. 7 p.m. And then reading games until 10 p.m.
What part of the day do you want?
No, just at the very top. And then I'll take
Can they hear me uptown?
Yes, they're on mute, so we can't hear
So we
them.
can't hear them again. How's everyone doing? Is that all the energy I can get? How's everyone doing? What about uptown? How's uptown doing?
They're on
They're
mute.
muted, but I see hands. So we're waving back at you in case you can see the hand. So, there we go. How's uptown doing? Excellent. So welcome to the first nursing home. Excited? What an outstanding week. We're talking about Nurses Week, and we're celebration.
No, ma'am.
You can go back on mute now. Thank you. So what an exciting time to actually have this. This is always one of those weeks that I really like being able to address nurses in the healthcare system. Because you know there is not one outcome that happens in this hospital that you don't touch and are responsible for. Did you know that?
Yeah, that's right. Yeah.
Nurses actually drive healthcare in a hospital. You are the largest healthcare provider system in the country, and you actually touch every single patient. So this is my challenge to you, is to reshape how we deliver healthcare in this hospital, or Charlie Norwood. Because we're moving forward as an organization. But what I need for you to do to be part of that is that you have to take the lead in helping us drive that. We can no longer wait and say we're waiting for them, especially those of us in the front office to fix it. Because if y'all are waiting on us to fix it, we're lost. Because basically, you run the healthcare. We want to empower you to actually take the lead and really set those standards. Challenge what we do, how we do the work that we deliver. Now, if I were to ask you a question, I'm going to start with you just sitting right in the front row. What could you do, or what would you say you need to do to make things different and better in this hospital?
Well, you already know the answer because you heard me on my soapbox movement already, but I think get compassion back in action into how we deliver care.
So what is compassion and action look like? I'm actually going to steal that. I like that. He told me to hire the CIA. That's what we're going to do.
That's right.
We're going to hire the CIA here to really work on compassion and action. But I love that. What else? John, what else? So you think I knew her name, did she?
Like he said, the compassion, which is, doing the right thing and really trying to connect with your patients and not saying that's not my job and going out of your way to make sure their experience is good as well as your workers.
Right. Go to this side of the room. What do you think we can do? Right there.
Okay, Nana, well, can you repeat the question?
No. No, the question is, what can we do differently in this hospital to make things better for our patients? Because nurses drive that change. What would you recommend?
I would recommend
Full staffing? And we're working on that. You gotta keep the people here though for us to get the full staffing. Okay. So how do we do that? We gotta change, yes ma'am.
we use more stop the line.
We use more stop the line, exactly. Love that. Empowerment to know that you have the ability to let myself know or anyone know what's going on in this hospital that's preventing us from delivering outstanding patient care. The buck stops with me, but I don't know where the buck is at if you don't tell me where it's at. Because you know what's going on with the delivery of the care. You know what we're doing and what we're not doing in the hospital. And I want to empower you, baby, because in order for us to become the outstanding healthcare system that we should be, and we're a great healthcare system, but we want to be outstanding, it has to start with nursing. Nursing has to be on the forefront saying how we need to drive, how we need to change that delivery of care. Because every patient is touched by nursing in this organization. Every outcome is driven by nursing in this organization. So this is not just a week to just say we're going to have a week, because we have a lot of those weeks running around. I mean, I saw a list of like 47. This is one of those most important weeks. Because if we're going to be in the healthcare business, which is what we are in, nursing has to drive that for us. So that's going to be my challenge for you and each and every one of you. As we stand up the practice councils that Karen's talking about, as we set up those engagement councils, when you'll be meeting with me, telling me how we can change the operation of the hospital, I want to hear from you on those initiatives. Because it has to start to change that. Every outcome. Our patient rating of how our inpatient services isn't the best, but I know you can change that in 6 months if you want to. So let's get together and do that together, make that change. And congratulations to you, and let's applaud each other for your week. That's the best thing you got. I mean, that's what it was, a boss clap. Like, oh, it's so cool. Can you give me a better clap than that? When it's not like a boss? That's better, but we're going to work on that because y'all got to get a little rowdy if you want to change healthcare. Karen, I'm going to turn it over to you. Congratulations and thank you.
I'm going to stand over here because Phoebe gave me a lot of notes to use. And I am going to read what I have to say because I'm losing my voice. Uptown, I'll do all I can so that you can hear me. For those of you who haven't met me, my name is Karen Cook, and it's my pleasure to be your nurse executive. Dr. Jackson made that position permanent for me back in February, and it's, dependent on all of you that we be successful in the organization. So I'm here to represent you and to support you in the care that you give every day. This week, we celebrate the profession of nursing. The American Nurses Association provided us the theme of 4 million reasons to celebrate. What they're talking about is the millions of nurses at different levels that we have in our country, working all across our hospitals. But as nurses in the VA, we have a lot more to celebrate, because we have the privilege of working with each other to deliver care to our country's most deserving citizens, our veterans. As we participate in the variety of activities planned by the Nurse Retention Sales Team and by all of you on your units, I invite each of you to consider your own motivations for choosing nursing as a career, Charlie Norwood VA Medical Center as your employer, what you want for your future in nursing, and what you mean to the future of this medical center. Nursing is a profession of high accountability and commitment that differs from other professions. For the 17th year in a row, nurses are the most trusted professionals in America. In 2019, 84% of people polled identified nurses as the professionals they trust most. By the way, in 2018, it was 82%, so we went up. This is not an anomaly, and it's not just someone's opinion. When you call your doctor, it's usually your nurse who calls you back. When you go to the hospital, it's a nurse who sees you first. When you visit relatives and friends who are sick in a hospital, it is a nurse, a member of nursing, who attends your relative while you're visiting. On Christmas or Sunday or Wednesday, when you go home and leave your family member at that hospital to enjoy a holiday meal, or to go to soccer practice, or to go to church, it is a nurse that stays at a hospital with your loved one 24/7 to ensure their safety and their wellness. When you and your family go home to convalesce after an illness, it's a nurse who calls to be sure you are continuing to heal. We can see all of these nurses in our minds, but the key to remember is that this nurse is you. It is each of you employed at this medical center, and it is each of the 4 million nurses across our country. The person who calls the patient back, greets the patient in the emergency department, provides continuous care, inclusive of family and significant others on holidays, weekends, and all hours, and ensures the patient continues to heal after going home, is you. The nurses of Charlie Norwood are the backbone of this hospital, providing excellent care while continuously evolving the delivery of their care through the scrutiny and oversight they apply to their practice, the application of evidence, personal professional development, and accomplishments in a collegial, collaborative, and ethical manner. That's why we are all part of the most trusted profession in America. My thanks goes to each of you for the work you do every day, for your flexibility and commitment to meet patient care needs. In addition, today, I would like to thank the members of the Nurse Retention Sales Team for their planning efforts for this year's Nurses Week. Some of you are already standing up, but if you would just stand up to be recognized. Some of you aren't standing up yet. I appreciate their efforts. I've been giving them instruction for 3 months, so. The future of nursing at the Charlie Norwood VA Medical Center is strong. The unit-based councils will be reestablished under a shared governance model that supports nursing excellence in a high-reliability organization. Simply stated, the members of our unit-based councils will be responsible for identifying needed improvement, evidence-based standards, implementation of changes in the delivery of care on their unit, in a standardized manner across the organization to provide the best outcomes for our patients. Members of these councils will represent to our reestablished Practice Council, Nursing Quality Council, Education Council, and Nursing Management Council. This model will provide a professional model to you as the nursing staff of Charlie Norwood to collaborate with each other in assessing, planning, implementing, auditing, and determining the nursing care provided and the process for delivering that care in this medical center. The 2020 staffing methodology will be completed by representatives of each unit. This is an opportunity for each of you to propose the staffing needed to provide care on your unit. This month, we will invite recommendations of new membership to the Nurse Professional Standards Board. This year, we welcomed food and nutrition services to patient care services. Our respiratory therapy and clinical documentation improvement groups are transitioning to new leadership under other PENTAD members. New organizational charts for nursing and patient care services will be published in June and available for all employees on our SharePoint. Our partnerships with NNU and AFGE are strong. I have always valued and continue to value the collaborative working relationships I've had with Ms. Billiter and Mr. Darasol, and will continue to embrace the balance of management and union working together in this medical center. Education and training for nurse managers and chief nurses is planned to ensure a consistent and fair application of employment processes for all employees in the service. We have fully engaged the daily management system on each of your units to drive communication and correction of issues by empowering all of our employees to bring concerns forward, resolve at the lowest level possible, and raise recurrent or unresolved issues for attention by others. The all-employee survey is coming soon. I encourage everyone to participate. Participation is the only way we have accurate feedback on the current state of your employment in this medical center. The VA Mission Act becomes effective in June 2019. Mission is an acronym that stands for Maintaining Internal Systems and Strengthening Integrated Outside Networks. So for all of you who may have been told that the Mission Act means that we're becoming an insurance company, that's a really bad rumor that we can ask Dr. Jackson to bust on Rumor Busting Friday, because that is not what they are doing, okay? The act is intended to streamline the community care process, establish a new urgent care benefit for our veterans, provide more veteran-to-veteran peer specialists to support them socially, provide telehealth in veterans' homes, a VA facility, or in the community, whichever is appropriate, expand the program to support veteran caregivers, provide more opportunities to hire and retain our excellent staff, and foster new strategies for addressing the needs of VA healthcare facilities considered underserved. We will all hear much more about the Mission Act over the next year. Prior to taking any questions, I was told to go ahead and do the recognitions. We do have awards. The awards were very important to me this year. It is my understanding that probably the most important award that you can receive is one that's nominated by your peers. This year, 100% of our awards in nursing for this event are peer nominated. Nurse managers and chief nurses and I did not vote. We did not decide. All of you voted, and all of you determined who you think the person at each level in our nursing department exemplifies best the criteria that we provided for your nominations. The first award is a Rising Star Award. I happen to know the person's not here to receive the award. She's on vacation. However, the criteria was that the individual have less than 2 years of practice, the capacity to develop essential nursing skills quickly, innovate and have the ability to motivate and inspire those around them, contribute to Charlie Norwood and their current unit, and go above and beyond to meet the needs of their patients, their coworkers, themselves, and the mission and vision of Charlie Norwood. Some things that were said about the winner. She has a positive impact on coworkers, patients, and students. She's a member of our unit-based practice council, chairs the unit employee engagement team, brings ideas for patient care improvement forward, receives several complimentary cards from patients and families. She is professional, all about teamwork, does things the right way, goes above and beyond, volunteers to assist others and to float to nights for coverage. This year's Rising Star Award will go to Hannah Smith from 60. Our next award is to a non-licensed caregiver, a nursing assistant, health tech, medical instrument tech, could have been nominated for this award. The award criteria are that they demonstrate effectiveness in improving and delivering patient care to veterans, and that they work with the RN and other members of the healthcare team to provide outstanding care to our veterans. We had 2 nominees, Jose Martinez Alamo and Keisha House Oliphant. The statements about our winner. The person has been a federal government employee for 14 years. They initiated life-saving CPR in the Valley area one day. The member nursing assistant, they're a member on our nursing assistant board for new nursing assistant employees. They're an excellent customer service individual, and they have a high standard of professionalism, and they are a team winner, a team player. This year's winner is Keisha House-Oliphant from our emergency department. She's uptown? Okay. Our intent when we had our winners was for the people who nominated them to have a picture taken with them receiving their award. So at an event this week at the emergency department, we would like to do that with the emergency department staff who nominated them. And if Dr. Jackson wants to be in the picture, I will. For the LPN, the criteria was demonstrates effectiveness in improving and delivering patient care to veterans, works with the nurse and healthcare team members to provide outstanding care to the veterans, achieves recognition from coworkers for excellence in the provision of care. We had 4 nominees: Karen Goodwin, Barbara Dudley, Ken Leon Guerrero, and Kimberly Hill. Statements about the winner. They serve on the interview panel for new LPNs. This person is a team player. They moved from the emergency department to the women's health clinic, learning a new area in a short amount of time. They volunteer to assist others who are busy, including offering them breaks, above and beyond to assist coworkers without needing to be asked. They work with a smile and they respect all people around them. And they assist veterans who are lost or need assistance understanding almost anything. Our LPN winner this year is Barbara Dudley from the Women's Health Clinic. The registered nurses. The criteria was that they demonstrate expert in nursing practice, they collaborate effectively with other healthcare colleagues, they demonstrate integrity and adherence to the nurse profession's code of ethics, and they develop and implement strategies to improve our organizational performance. Our nominees were Johnetta Travis, Michelle Doolittle, Lauren Collins, Geraldine Washington, Celeste Dunbar, Thomas Jackson, and Justin Abel. What was said about our winner? This individual has been a nurse for 27 years, 16 at the VA. They obtained their master's degree in 2018 in leadership and management. They train staff and create SOPs for new equipment. He educates himself on surgical procedures for his area. The leader of the medical response team at his church. He's a previous nurse manager, well that just gave it away, didn't it? Provides seamless patient care with interdisciplinary collaboration, excellent rapport with his coworkers, volunteers to help going above and beyond. He's compassionate, respectful, and takes responsibility for what's occurring in his clinic, works patiently with veterans and their families, maintains high standards of infection control and quality care, leads on performance improvement projects, helps to maintain nursing education boards. He's a member of our SAIL RN committee and ensures procedural appointments pre-screened and all information correct, which increases the surgical efficiencies of the organization. Of note for this particular nomination is that this nomination didn't come from nursing. This nomination came from the interdisciplinary team that works with him every day. And our winner is Thomas Jackson from our ENT. Is anybody who nominated him here?
So you're it, Karen.
So we will come to the ENT clinic and take your picture. Okay? Because I think it's very important that you have that picture to hang in your work area of all of your friends and coworkers who nominated you. Congratulations, TJ. For our next level, we actually had a tie, and so we do have 2 winners. It's for an advanced registered nurse or a nurse in a consultative role. The criteria was demonstrates expert nursing practice, collaborates effectively with other healthcare colleagues, demonstrates effective use of evidence-based practice to enhance or improve healthcare outcomes, develops and implements strategies to improve organizational performance related to resource utilization, and promotes the image of nursing and the nursing profession within the community. I think Phoebe's playing with me because that font's like half the size of all the other fonts on the paper.
I was tired.
Anyway, our first winner this year, she's been a nurse for over 25 years, provides clinical expertise to the staff by being a clinical resource, providing patient care and training to new staff, is part of our professional practice in the community. She does teach at university, she guides students and staff. She's a problem solver, she's approachable, dependable, and knowledgeable. Facilitates all of our secondary programs, BLS and ACLS, especially for our physicians. And supports management and education as needed. She fills in as PCC on nights. She maintains her critical care certification and notifies other staff of upcoming opportunities. She's a liaison between staff and physicians in order to have those difficult conversations about optimizing our patient care. She chairs the Clinical Practice Council, assists the VISN with clinical simulation planning, is a member of multiple committees. And our first winner is Heather Thomas, who is our nurse educator in our ICU. Heather's not here today. That one we knew in advance that she would not be here today, but we've already made arrangements with her manager to go to the unit and provide her award. The second winner communicates and collaborates with the interdisciplinary team, ensures timely response to veterans, is a member of the nursing cell retention team as well as the professional development council, goes above and beyond with customer service with high integrity, professional at all times, using listening and calm voice when speaking to veterans. She is instrumental in the nurse triage call center process, educates new employees during orientation, graduated from our LEA program, teaches on the moment classes. She's a graduate of our 2018 value program. She's a member and education chair of the Chi Eta Phi nursing sorority, an instructor at the University of Phoenix, and there's about 10 other things listed on this chart. However, our second winner is Barbara Welcher. And I believe Barbara works uptown in Women's Health.
No, triage.
Triage, oh, all right. That's the end of our peer-nominated awards for this year, at least at this level. And so I am now open to questions. Who would like to ask what? Or we can just go enjoy the nacho bar. Uptown? They're on. Does anybody have any questions? Now's the time to ask.
The approval process for open position,
Yes.
what is it?
You can't have any, no. The chief nurses actually are aware of that approval process, and there are some resource documents that they fill out and they bring to the chief nurse meeting, and we prioritize based on what we can afford and what the needs in the medical center are, probably not in that same order, but in reverse order, but what will be hired next. I can tell you we haven't had to go through that process yet because Dr. Jackson signed the MCRC minutes from March 31st, approving everything that people had in that MCRC old system. Once a determination is made of what will be recruited for next based on the priorities across the service, it will then go into a new MCRC that's been created by Mr. Stanger. And once it's in there, it's automatically approved and goes straight to Human Resources for posting. So there is no delay in getting an answer on whether or not you'll be recruiting. Any other questions?
Is there any changes coming about patient transport or with anything that will help out with the nursing or staff
We
having to
actually-
transport their own patients?
We actually had some conversation about that today at the PEMTAT level. On the org chart, it says we have a float pool. However, for a lot of people, they believe it's a transport pool. That pool is not fully staffed. There's 15 FTE allotted for that pool. After our meeting today, I immediately sent something out to all of my peers across the country, and I've already gotten about 15 answers as to how they handle transport in their medical centers. if they have unique transport people. Unfortunately, a lot of them are calling back to me saying, we just suck it up and we do it as the nursing staff. However, a number of them actually have some very innovative programs for transporting patients that we'll be looking at to reestablish some support to do that, especially during those hours from, say, 7 a.m. to 7 p.m. where most tests and transporting is done.
Has there been any consideration to any type of sitter pool or something that allows us to offload the high percentage of one-to-ones that we get in that decrease the amount of people I have that are able to care for patients?
So I've been in communication with another ADPCS who actually rewrote a sitter pool thing, and what they have is called therapeutic companions. And those therapeutic companions, they do have criteria for who can actually be placed on a one-to-one. It doesn't really address homicidal and suicidal patients who are at risk to themselves or to other people. They're automatically placed on a one-to-one. But there is some criteria as well as interventions that the nursing staff must demonstrate have been used and are failed with the individual veteran, and they can then ask for a therapeutic companion. And we are looking at, depending on what we do with our transport group or our current float pool, using those FTE to provide on average a number of people across the medical center to cover the one-to-ones. And we've been looking at the data on how many one-to-ones on average we have in the medical center at one time. Unfortunately, sometimes we have 20 and sometimes we have 0, and so it's not very easy to look at the average, but that's what we'll be looking at. Any other questions? Dr. Jackson.
PCS for a while. Who's the best director you've ever worked with?
Not like he's searching for a compliment or anything.
He's not fishing or anything. It's a privilege to work with Dr. Jackson. And I'm not saying that because he asked the question. I will tell you all that my chief nurses will tell you that I have said nothing to them except I have Dr. Jackson's full support, as do all of us in nursing, and that it's a pleasure to work with a director who will listen and who will respond and who will act on the needs of nursing. And there is no dysfunction in the relationships. It's just we have a very good group in the Pentat office right now. People enjoy each other, they like each other, they respect each other. And I have found, at least through my temporary assignment, as well as since I have become the ADPCS, it truly is a pleasure to work with your new Pentat. And my nurse managers from surgery would tell you I don't say that lightly. Any other questions? Okay, enjoy the nacho bar.
All right, wait, we've got some giveaways. I got some
okay.
giveaways. I'm gonna ask a few people to, can you draw? Oh, look. Should we call them? Liz Awad.
I'll be right there.
Well, it was actually the director who drew yours, so you said the check goes to him.
But it's my handwriting.
All
right, Teresa Edwards.
Okay, if you draw your own name.